Hi, folks. Today is Sunday, April 19th, and it's been a pretty rapid weekend. Much has happened. We started on Friday with our testing for the COVID-19 virus. As you know, we decided that we would test 100% of our staff in an attempt to know more than we knew now, to know if we had anyone who was asymptomatic but positive, simply because in addition to the screenings that we do for symptoms when our staff is coming in, someone who may be asymptomatic but positive could be bringing the virus into our community without knowing and without us knowing. So we started that process. It's Sunday afternoon. At this point, we've been through just about 700 tests. Our staff at Birch Hill has 100% been tested. We're through the majority of our staff for RiverWoods Exeter and RiverWoods Durham. In addition, we've tested our healthcare residents at Birch Hill and our healthcare residents at RiverWoods Exeter. And as we anticipated, we do have some asymptomatic but positive cases. They are, at this point in time, what we know is we have some cases at our Birch Hill community. We have some asymptomatic positive health center residents and a few asymptomatic positive staff. In addition, Birch Hill has 3 staff members who did show some symptoms and were tested outside of Friday's testing in Manchester. So that's not great news. For sure, we had hoped that we would come out of this and find out that everyone tested negative. What we have is 7 healthcare residents who have tested positive at Birch Hill. But of those folks, we have 1 person with very mild symptoms and 6 people with no symptoms at all. I'll tell you, if you can feel good about having positive results, positive cases, I do. Because what we know now is far more than we knew Thursday night and Friday night and Saturday morning. We know who's positive. We know how to adjust our healthcare measures, our PPE wearing. We know how to adjust staffing, because we had some staff members who were asymptomatic but positive. We know that we can stop any spread that they may have unwittingly shared with the community by taking them off the schedule until they're healthy again. So I'm not happy that we have positive cases. My thoughts and my prayers are with our staff members and with our residents and with their families. But I'm glad we know. Knowing is always better than not knowing. In this case, I would have liked to know plenty of great news, and the reality is we will know plenty of great news. But we'll also, most likely over the course of the next few days, as we get in results from Saturday's testing and Sunday's testing and Monday's testing, there's a real chance that we'll hear more hard news, more news where we have folks that show no symptoms, we have no reason to believe they're positive, but they are. And that allows us to take action, it allows us to change our course and to adjust to keep you healthy and safe. So where we are today, we expect that we'll have more results tomorrow, we'll have more results Monday, Tuesday, and we'll keep you updated. I guess I would just end by saying where we started a month, 6 weeks ago, to where we are today, our team has been just amazing rock stars. These are people who are adjusting on the fly, who are changing our operations on the fly, and who, spent their weekend getting their nose swabbed or the back of their throat swabbed to protect you. And I think that's pretty amazing. And I think it's a group of people that you have every right to be proud of, and I certainly am. So we'll know more. And the more we know, the better decisions we'll make. And we'll keep letting you know what and why over the course of the next few days. Thanks. Wash your hands.